here, what's going to happen is when I open my 3/4 sheet, I do this, drop towards me, away from me. If you have a single ring stand and you're working with one, all of this can kind of go up in here because we use different stuff, right? So whatever you get, right? If I have, say, just a surface, then still open toward me, away from me. Whatever this is, it's all the same concept, okay? And like I said, if it's smaller, if I have a single, all of this, again, I can figure it out and sort it out, okay? The other thing that you don't see, here are my sharps with a suture loaded, okay, in my kidney. I made it a sharp zone with a nice towel, so it's obvious. And underneath, you can see my extra saline here in my dirty. So I don't know if you guys need a picture of that. Okay, so all of that. Any questions there? I have some laps for my dirty, extra bovie, extra, like I said, your form doesn't say everything. It's a starting point, okay? So that cheat sheet is for you to sort out. Ms. Garza will let you know how many times you can use it or post it to memorize, whatever. I also start with my laps ready. Minimal stuff on my bovie though, right? Or on my mayo, right? Any other questions before we get going here? Okay, I got extra surgeon's glove and gown for my dirty, okay? So, oh, and extra 4 towels for my dirty, okay? This is my dirty, okay? So that's how I set up, is if I'm gonna just push my mayo out of the stand, or my mayo stand out of the way to keep it clean and pull up this at the time of dirty, I know what I'm working with. Does that make sense? Okay.
All of the instruments are pointed up so that you can see what you got.
Except sharps. Scissors down and sharps visibly seen. Not hidden, not under a gown, not something sketch. Okay, what if I have to get relieved? Right? So just make it obvious, right? Okay, any questions on the count? Anything else? No. So, we're going to start from that. Yeah. How are you? Doing good. How was your weekend? Pretty good. Let's start with some towels.
You want to do a 3/4?
Yeah, we can do that. So you guys know all this, right?
Yeah.
Mr. Valencia, can we get some light? Okay, do you guys know how to do if the surgeon needs these? Take it all with me together. So here you go. Do you want some clamps, Doc?
Sure.
Okay.
Thank you.
Can I place?
Please.
Okay. And this is how the clamps go. So you're gonna some surgeons don't mind if you take them all at once, some one at a time. Okay, so the same kind of passing. Okay, and usually they'll let you know if they want you to help with this.
And when you place, you leave it, remember? Handy.
Yes.
So for example, these are getting buried, so you're already recognizing that for your count, right?
Yes.
Also, don't forget with the towels, you can also do 3 to you and 1 away. So that last one.
Can you do that last one for me,
Yep.
please?
I got you. All right.
It's a beaut. Repeat first. All right, all this is the same.
To just pull it forward, okay? Walk down a little bit, give me some space. I have some of these. Oh, light handles. Some for my dirty, some for my clean. Okay? So, no tape Do timeout. This is Dracula, date of birth 1300. No month included, no day included. This is an exploratory laparotomy, possible bowel resection, allergic to sunlight, latex, and garlic. Non-latex. Okay? All right. Everything good?
Yeah.
All right.
So instruments are still unaccounted for.
Fire risk is low.
Alrighty, here we go.
So she goes around the belly button. Okay? All right, thank you. And this is, ooh, look at that.
Interesting.
10 blade.
Thank you.
Do you like gouets? Army navies.
Army Navy's to begin.
Okay?
Especially when you guys don't know what we like to go or use for this case, you guys could definitely ask like how this is done.
What do you prefer, Doc? Oh, my towel.
Just kidding, you saw nothing. Like that. Okay, thank you. Thank you. Well, I was gonna really do this one.
Okay?
I had to cut it to pretend. Alright. Is it an aspirator too?
The Bobby?
Sounds like a sprinkler. Alright, so this would be fascia, after sub-Q fascia, so I'll take acre mayo and that.
So this is where things get tricky. Doc, I got my curved mayo in the dirty, which I'd like to save. Can you use a straight?
Sure, next time can you pull, have two in them?
Next time I can.
Ferris, please. Thank you. You don't have to have two mayos. You can, I can be like, oh, okay, I'll go with the Bovie. I'll go with,
Now we actually got to cut though.
I know. Interesting layers. The soft stuff was there.
You sit on the back?
Yes, I did.
I'll
The
tell
lefty.
everybody in
It's
here.
not a dissecting. This would be muscle.
Let's get to it.
So we're down to peritoneum, right?
This is muscle.
What'd you pass?
Sorry, let me give you something else then. You've got that, and here's that.
You wanna just pull?
Next is peritoneum.
You like to pull muscle?
I don't think they do, except in C-sections, really.
They just
This is
separate.
what they'll
Just cut
do.
it.
They just separate. You don't cut muscle. You separate muscle.
Like
And I
carne
have-
asada, like separated? Yeah?
With
It's
the
like a
curve.
blood dissect. It's it's striated, not just that, it has those fascia layers in between that you can really just poke through. Alright, so this would be peritoneum, and I'll take that and that, yes. Permet, Stabaki. Alright, so we are getting into big belly here. We want to do the exploratory part, right? To see what's going on with our patient. We know most likely that we are going to resect.
See how I'm one-handed too? Working with it, no big thing.
Oh, lefty's not working.
So at the moment of this case, right, where it's possible now, they're
Can I
doing
get a bowel cord?
exploratory.
Yep.
So they're gonna start using sponge sticks to kind of look around and kind of using labs to kind of move around. And everything inside is always moist. And
Do you want a
what
bladder
type of
blade
moist?
with that?
No.
Are we using warm saline?
We are
as
using
well?
warm
Right?
saline.
Thank
Oh.
you. Oh,
Back to the
Oh. My
Weapon.
for bruising our
Swan.
patient.
Oh, it was
Blades down, nut up.
bonito.
Tomato.
Now you got me looking back in front of Miss Henrietta.
No.
So we wanna do this.
Oh, she's coming.
Alrighty, so I'll go ahead and take that sponge on the stick and the baby, please.
what happened?
Mm-hmm.
How come nobody has on a hat?
They asked, we said no, it's demo day.
Put on a hat. This is the OR. Thank you.
I did get on them about regular days that they asked.
So what happened? The thing was just backwards?
I didn't set up the bill for me.
Oh.
It was,
Did you do it on purpose?
No.
You put a wing net down.
we have an obstruction here.
We do.
We do have an obstruction. I'm gonna go ahead and reset this portion.
Okay.
Yeah. No, we're just gonna go ahead and reset.
Okay. I'm gonna switch over, so can you pull that back? I'm going to pull over right.
You need more?
Yeah.
Oh,
He needs one. Well, we need more down there.
Can I keep this to baby?
You know what, I'll take it. I got another one for you.
We still need more on that side.
I've already had it out.
Alright.
So when she says, you know what, we're gonna have to resect, that's also code for, you know what, I'm gonna also start laying another layer of towels, okay, over my stuff. I'm gonna pull out some of that.
Yes, because it needs to go.
And I got 2 laps under the towels, okay, one? Mr. Valencia?
Make sure you have access to your bogey and your suction still.
Okay, and, or, I
That'll be when we go.
have another bogey for the queen, so I have that all set up, and my suction, I kind of just put it like over here, okay? Stay over here, we haven't done any yet, so that can go there.
There we go. I like that.
All right,
That's fine.
can I get my staplers?
And then I will take that right angle or snip, something like that.
Okay.
Show the window.
So let's do 04/2025.
Okay, 04/2025. That is basically next week.
Yeah. Good thing we're using them now.
Yep. Thank you.
Ways to
So,
save the
remember
hospital
you
money.
guys, I showed you that over here I have extra saline to rinse this with, right? When I do the reloads, okay? And,
And we have 05/2025.
okay, so 2 months. Check. Thank you. I'll take that linear staple. Okay, perfect. So what you're gonna do when you pass this is you're gonna pass the loaded side always first, okay? That's what they're expecting to receive, okay? And they're gonna kind of grab here as where their hand is gonna go, okay? So kind of like that, okay? Okay.
Is when I'm gonna. Okay, we're not gonna really do it because then it would.
Okay, but you do gotta cut it, so I've got that.
Okay, that's that. What you gonna do with those?
Rinse them.
Rinsey and
Reload, reload, right? Okay, so my reload, remember you only touch here, because if you touch anywhere here, you're gonna get a split glove, cut glove, okay? So only this proximal end, okay? That's gonna go, rinse. Got my reload ready to go. Juan, I have some reloads on hold over there, 2 whites and a blue.
Yep.
And I'm ready to go, right? So a rinse and a reload. I'll take, how many are we gonna need, Doc? I got a white loaded for you,
2 more, that's fine, at least 2 more.
okay?
You want blue or white?
Can you take
Blue or white?
white?
Okay, so when it comes new,
That's fine.
he's confirming it with me, looks good. There you go.
2025.
Do you have to repeat it back?
Usually not for a reload, but I say +1 to the count for reloads, okay? It's gonna come with this protected
No, it doesn't.
layer on it. Can you see that?
I think so.
So you can't see where the staples
No,
are,
it doesn't.
okay? So this just comes right off, okay? This is trash. You don't need this. Just don't touch that part, right?
So 2 reloads on the field card.
I have +1, so 3 altogether.
If this is not going on, try to open it a little bit more because it is exact. So just open it a little more and it'll go on. Just like that, okay? And close it. Again.
Okay, so now I have this area.
Here's this back,
Thank you.
this back.
Okay.
So that would have cut, go ahead and cut a segment off. Cut and staple. That, sharpener doesn't really work on the scissors. That's the real thing. So this is my specimen.
Okay. Can put it in here. Okay. Oh, in your added stuff that you need for dirty, right? Labels and your skid marker goes from your clean to your dirty. Okay, because I need to label this what specimen it is, right? So that's sitting here though, and I'm gonna pass it all together with my dirty and my sharps. So when I am communicating to my circulator in a sec, when we switch back over, I'm communicating I have specimen, what it is, what sharps I have, and it's all dirty. All those 3 points, okay?
Okay, and at this point, I will take that third staple, thank you. Thank you. Actually, let me use this. Because these are completely closed, I'm gonna cut off that portion.
Okay. You want it for specimen
We're
too?
definitely dirty, yes,
Okay.
please. My goodness. All right, so first one goes down.
So what's this called? But which kind?
Side
by side.
Right? The two ends are end to end, that makes it easy, and this is side by side.
Maybe some water.
Yep. How many more reloads you gonna want, Duff, or you want the other stapler next?
I want the other staple next.
Okay.
Once I do this side by side, I'll be good. Alright, we got these big fat pen rounds so that they can work a lot better.
Then
Just
that
make sure
means-
that we are stapling so that they can fit in there. You guys get the gist though, right?
Yeah.
Okay.
So I also have, after she does the side to side, I also have my suture loaded, a knife, and my stapler, all options ready to go for
Beautiful.
whatever she's gonna want.
So
okay?
this is when we are.
It's usually pulled up all the way on
Yeah,
the stapler,
put it in
okay? Yeah.
Okay. So again, this is when it's gonna go back together.
Except it's holding in here, right?
I do.
It'll be in there. So it'll cut and attach. So this will be one big opening, okay? This is still closed at the end with 2 openings at the end, so that's when we'll do our next stapler.
You don't wanna do it once?
Bariatrics.
Just one.
Yeah.
Just grab the stomach.
Oh,
That's right, I seen it
Going from
with
south
the
to north.
for a demonstration,
How does he
you want?
work?
When you go clinical, you have
Oh,
to bring us
I don't
on,
know if it's that
What?
low
You have to
will
bring
load,
us
but
on.
we can try.
when you go clinical.
So how it opens, and it makes one big wide opening.
Wow.
So it cuts it down.
360? There you go. How was that?
Yes.
We'll take that off. Oh, watch out if little staples fly, okay, you guys? Like if you actually, that's why we're not really doing it, but, I don't want you to get fed, so just watch out. They look like a little, like a cassette thing.
So then this, because it's open that way, so we kind of do that, so that it's closed on the top. Of course, it only has a small opening. Okay? So 3 Alice makes sense now?
Yes.
And then I'll take that third stapler. Do you wanna hold these for me?
I can hold them.
That. Thank you. Ready to use?
This one is-
And then this one, so she's gonna pull for traction, right? I'm holding, and then we're gonna boom. Okay? And then
You need a knife, Doc?
I do.
Okay. Okay, so I've
Do you
got
wanna
a,
leave this on or take that off?
did you fire it?
I didn't. Do you want me to fire it?
Fire it.
Well, we don't have
Fire it.
reloads on this
I
one.
don't know if there's staples in
Alright,
there.
we're just gonna go for it.
Okay, so that's fired. So remember, this one doesn't cut, it only staples, right? So this is still attached.
Yep. Didn't go.
Didn't go. Alright, well.
Alright,
that's
and I'll
that.
take that knife.
10 blade fresh.
Okay, hold up.
And you might need this. Would you like to, suture that next?
Yes, I would.
Okay, I've got a 2-0 silk coming in on an SH.
Like that.
Does anyone know what kind of suture we're using for like,
I like purple.
like the bowel like that? What kind
Is he still like purple?
Some blunt, right? Some blunt needles.
Blunt. Alright.
Okay, so do you wanna send this for
Yes,
specimen?
that goes to specimen, please.
Okay.
You would like liver as well.
Is that what SH is?
Alright,
SH
thank
is
you.
a type of
There you go, Doc.
Sorry.
size.
So anything friable is blunt, right?
Yeah. So like liver as well, they'll use a blunt.
And the suture would be non-absorbable or absorbable.
Non-absorbable if they want it to last. Usually with like, the only way they'll use a
The pop-up.
non-absorbable, it would be like.
No, it's
like
not.
if they're doing
Oh,
things
what was
that
that? The
they
baby
want it to
down.
hold.
The pocket.
You need another one, Doc?
And that's common jargon for the, OR, the baby down. Can you cut for me?
Yep.
Dang it.
Only have my straights with the clean, right?
So
So I'm gonna use this to cut.
but,
I'm
what
gonna
was
use
I
a
saying? Oh yeah,
continuous.
so like
I don't wanna
probably
interrupt you on
non-absorbable,
bowel.
they'll use that for like, vein to veins, like something that takes too long to heal. Something
Want me to follow?
that is really fast to heal, they'll use it.
No, you don't need to do a count on bowel.
That's why too, they use like a PDS.
Bowel.
Like these layers, they'll use like a PDS, something that's gonna hold for a long time.
And it's just like,
That's non-absorbable.
Reinforcing suture.
So the next steps after she does this though, is we will redo everything, right? And then when we get back, the first thing we're gonna do is irrigate, right? Okay, so, cause I got dirty irrigation, right? So this is not gonna be used to irrigate.
That's dirty, that's dirty.
This is dirty. Okay, so she just also made that Bobby tip dirty, I'm gonna take that with me. Okay, and I'm gonna throw that off. Okay, and.
Alright, I'll take a sponge on a stick. So I wanna push this back in and just take a look around and we'll.
Okay, I got a lot for you.
Alright, that looks good to me.
All good?
Yep, let's go ahead and irrigate and close up.
Okay, we will switch this all out, so.
Do you leave these or can we fold them down in the past? You wanna leave them?
10 blade, a suture there. I've got plenty of all the reloads, all staplers. I've got a specimen under. This is all large bowel colon. Doc, how would you like that sent?
I would like that, we can send it frozen, actually.
All
Frozen?
together?
All together,
All together,
and
please.
all of my dirty instruments.
Okay, done.
So he's gonna take that and sort that out, right?
For over here, but for now. they
Now,
use
what am I doing? Switching everything over, okay? So the first thing I'm doing is getting rid of my top load, right? And I can start doing all this, okay? And this surgeon is also all dirty, so she's just gonna like walk over here, okay?
Yeah, it was right here.
It was on
Wasn't there? So keep your full section there because we haven't irrigated yet.
Okay, so what's gonna happen now is I'm gonna pretend I have a new drape, as you are also gonna do in your procedures, okay? So I've
In the
got,
real world, they actually do this, they'll just throw towels down.
but for AST purposes, you have a whole new drape, okay?
And it's layering.
And I have all this stuff still under there, okay? All of that, okay? So then I'm gonna new drape, put gown and glove my surgeon, and roll up.
You know what? I think we take Balfour out with dirty.
Oh,
it
you're
says
right.
remove laps from under the bowel cord.
You're right, we do. Okay, so send off this as well. And this.
That's why videos are just.
Yeah.
Do we have sound? Can you hear? Okay.
Okay, so then I'm rolling.
Well, not today.
So when is
Let's get over here.
Oh my God.
during the resection process,
Did you proof me?
so when
Yep, you're clean.
when you took off your gloves, would you change your gown as well?
Yes,
Okay.
I'm
Yeah.
clean, the patient is now clean,
I
and
pooped.
we
she
are
she
all
walked away, kind
a
of took
fresh
everything off and then you left everything.
pile of clean,
Okay, got it.
okay?
We all
We just came out of the laundry.
Alright, let's get that irrigation in.
All right,
Let me get some
Doc, would you like
retract.
asepto? or the
I
whole-
want the whole picture.
All right, I got warm saline,
Alright, and then I'll take the boulets.
okay?
Please.
There you go.
It locks up.
There you go. That's how you were set up?
What?
More irrigation?
Okay.
Yeah.
Asepto, okay?
Eso puedo like PG cacas.
So when you're counting, you have your plans underneath.
I know they're under there still.
We'll say 4 underneath, I'll show you when we, take our.
Yeah.
So pretty much after, and then that's
That would be like super dirty, huh? Maybe like go brown or something. It's bowel.
Thank you. All right, Doc,
There's
first
one.
up I've got for you.
My hand went down for that. So, cord management, you don't have any pockets, right? You don't have anything to hold on to, so.
Okay, so where is she now? She's on peritoneum. How many layers does your test form say?
Yeah, do we have to do something? No, I think we just do 3 as 1. Peritoneum, muscle, and fascia together.
Okay, well then in that case, I don't need that. I need that.
So that would change
I've
hers.
got a O Vital for you,
I
Doc.
love it.
And here you go.
So this is the count.
Okay, ready?
I threw it out because I used it.
All right, you ready?
Almost.
Almost. Okay, so if he says almost, I'm
Alright, now I'm
organized,
ready.
right? Okay.
See how that worked communication? He wasn't ready, so she has more time to get her stuff ready. You never sit and wait, we're always in time.
All right, I have, let's see here, laps. I've got one on the field, 2.
3, 4, 5, 6, 7, 8.
Okay, Raytex, I've got 1, 2.
Yeah, can you do the laps again?
Oh, laps.
Yeah.
1, 2.
3, 4, 5. 1, 2, 3.
Oh,
Oh, right here.
They're
4,
inside.
5. For 10.
So this circulator, you gotta watch him, right?
Yeah.
Because I knew I had mine, okay?
Bring the outfit, bring the outfit.
All right.
Hey, that's my brother, I got him the job, all right? You know.
Raytex, 1, 2.
Why did you go to school?
3, 4, 5, 6, 7, 8, 9, and 10. Blades, I've got 1.
2.
Okay. Hypos, I've got 1, 2, 3. Doc, we didn't use any local. You know what? I'll put it up just in case.
Yeah, we come out.
All right. Sutures, I've got 1 working, 2.
3.
All right. Bovie tips, I've got 1 on the field.
2.
Okay. And reloads, I have none.
I have
So let's count.
1, 2. And did I ever give you that 3?
So does the 1 count in the 3rd stapler that he handed me? Yes. Okay, that's a lot of facilities, as they open a new stapler, would have to add that as a reload. Okay? Even if it's a different kind.
1, 2, 3.
And so that one would make,
4.
that's what I'm saying, right? Okay? All right, so we good on laps then?
So you're
And
saying
we
the
good on
original
self
one
counts?
would be 1
The original one would be 1,
plus reload.
plus reloads, plus another stapler would be 4. Okay? So that's how we are now on instruments. You ready?
Mm-hmm.
Okay, so, for penetrating towel clamps, I will show you after the case, I got them buried.
Okay. sounds
Okay, so I've got one Edna.
good.
Alright, Kelly's, I've got 1, 2, 3, 4.
5, 6.
Okay, straights, 1, 2. Alice, I've got 1.
2, 3, 4.
Coker, 1, 2, 3, 4. Mayo, 1, 2. Babcock, 1, 2, 3. Right angle, 1.
2.
Schnittonsel, 1.
2.
Peon, 1, 2. Sponge stick, 1, 2, 3, 4. And needle driver, I've got 1 working.
And 2.
Do we have a third?
Nope, 3 on the
Yeah,
second.
okay. Scissors, I've got 1 straight mayo and 1 Metz.
And then I have a curve. Yeah.
Okay. Retractors, I've got 2 Goulets on the field. Harrington, 1. Beaver, 1. Army Navy, 1, 2. Richardson, 1, 2, 3. And on to my forceps, I've got 1 Ferris Smith on the field, 1 DeBakey.
And 2.
Okay. I've got 1 rat tooth. Adson, I've got 1, 2. With teeth, Adson plain, 1. And dressing forceps, 1.
2. And
Knife handles, 1, 2.
and 3.
All right. Balfour, I've got 1.
And 2, 3, 4, 5, 6, 7, 8. 1,
1.
2, 3, 4, 5, 6, 7, 8. Yeah.
Full suction, 1, 2.
You can take it off at this point.
Yep.
2 pieces.
2 pieces. So this time is when I would need that other yank hour, right? Because she's on the layers, no longer inside, right? So I can throw that in there.
And count complete.
Okay, first count is complete and correct, Doc.
Thank you. So it's okay for circulator
Questions for sub 2?
That's fine.
Cindy.
Let us know if you're.
If I'm down my laps, which I am, I'm gonna say, Doc, I got a Raytech for my dry. Already have it loaded up here. Everything's ready to go.
Go ahead and cut.
Right? Okay.
So now this is, so I did the 3 layers together, the peritoneum, muscle, and fascia together with no Vicryl. Now I'm gonna do the sub-Q with like a 2-0, 3-0.
2-0 Vicryl.
So you're gonna close the abdominal cavity, then you pass the your count, and then you close fascia and muscle layer. And
Does it
then
say
we
sub
count
Q?
again.
Yeah,
So the
now I'm doing
abdominal
the
cavity would have been the peritoneum then.
Okay.
Is that what
And then
that?
it says fascia and,
And muscle
Muscle.
together.
So now I'm doing a
So
soft
no
count,
sub
right?
Q, or would you do those 3 together?
so we usually do the 3
This is-
together and then sub-Q.
When you do fascia and muscle, we're doing the,
What was
This
the
is another
abdominal
instant
cavity?
count,
So I think yours is a typo.
That's gonna be on you. I'll leave that to you, to your discretion.